Hey, farm students. I thought I would take a moment and touch base with you guys in hopefully a little bit more enjoyable way than just another stinking announcement coming at you guys. So I know that yesterday was a big day. We had the Kahoot with 2,074 questions on it. And believe it or not, even with that, I left something out. So I thought because obviously my speaking abilities are probably considered subpar. Giving you more information to be successful on the test would be better if I brought along a little bit of extra help here. So I kind of asking, blackmailing, whatever you want to call it, bribing of another person to come and help me out. So introducing, you gotta put yourself in here so I can introduce you. Diane Christensen.
Hi guys. I was going to come in after the introduction.
Well, no, you're supposed to slide in at the time because otherwise it's like I'm talking to my Casper the Friendly Ghost or something like that, which you guys probably don't know either because you don't know New Kids on the Block. But that's
we didn't know New Kids on the Block.
They did not. They knew E.T. though, and the beam of light.
You knew E.T. We love E.T.
Anyways, to the point. So I know I sent out the announcement with the information about the ganciclovir. I'm pretty sure that's the name of the medication. If not, it's, close to it. Pronunciations are always, give or take.
I don't know what's wrong with you. I pronounced everything perfectly in Patho,
Is that
right?
correct, guys? Oh. Did she? Is she making me look bad here?
What did I say? Probably. What did I say a lot in Patho? Thank goodness I'm not your farm teacher.
And then, boom, guess who you get? Basically your twin coming at you. Oh my gosh, I go home every week. You guys feel like, oh, this week, this is what I did. That was stupid. But anyways, don't care about that. So
our pronunciation is not a reflection of our intelligence.
That's right. That's right. And also, we are of the notion where we like to explain things in a more fundamental way, because that's how you explain things to patients in a way that makes sense and understands. Right. So we try to practice that in our teaching. And anything we do pronounce incorrectly, it's because we're, always trying to make it real.
Yes, it's more challenging. And I've told you guys this in Patho before, to talk to someone or teach a family member or a patient when you're not using medical terms or the proper terms and trying to come up with something they understand. So that's another layer in teaching too. And that kind of goes with farm.
Exactly. So basically just what I said, but stated to you again.
In a different way. The way I said it to you in Patho.
Sometimes we need to hear things twice and whatnot. So
in a different way.
That's right.
Like our teaching
to
our patients and our families.
Oh
with
my
different
goodness.
words.
Oh my goodness. Okay. So back to the whole ganciclovir. How do you like that? I got it. Okay. Anyways,
impressive.
Thank you. And I meant to make a question with that, and I failed to do so. So this is kind of basically giving you a freebie here. I said I wanted you to know something, an adverse effect that we have to be careful with and monitor. Why are you laughing at me?
Suffer through this video, and you might get a bonus on the exam. That's just what went through my head. I'm sorry, but.
Hey. You should be flattered that I brought you here with this.
I'm the suffering
I didn't
part.
get to be the help with you. Gosh, I feel a little bit offended there. My expertise wasn't needed for farm with you.
Because I didn't teach farm.
Whatever the P class that you taught.
The P class.
So, but you probably didn't learn about the P system.
We divert back to that ganciclovir, whatever you were talking about. What is it? What is it about that drug that's so important?
What's so important about it is we have to look at a lab value, and the lab value is platelets. Mm-hmm. So of course,
the little clotting dudes
that always stick together. So I thought of a song that is super fun, at least in our opinion. Can you think of what song I'm thinking about low platelets?
Oh yes, because our favorite YouTuber ZDoggMD. If you guys don't know ZDoggMD, you should really tune into some of his videos. He does parodies. Carrie and I are probably his biggest fans, but a lot of people probably say that. But he does parodies on a plethora of medical stuff. Most of his followers are doctors and nurses, but he usually does really fun songs, and it helps you remember things. So,
and this song in particular is the Friends with Low Platelets. So I thought that that would be a fun way to get you to remember, and a little twist, since I'm all into the, hey, this is, BB, so remember all of these B's related to beta blockers, even though your test is on beta blockers, which is kind of LOL that I'm talking about it now.
Oh my goodness, she just can't. She's hot today.
Yeah, but then I lose my train of thought. Oh, okay.
The original artist.
The original, thank you. The original artist of that, the real song, Friends in Low Places, is Garth Brooks.
Or Garth Brooks. Jeez, I thought it was just Farm.
It's every day. It's all day, every day.
Well, see, that's good to know, because in a transitions video the other day, no lie, I called the state of California. It's me too.
Yes.
Yeah.
And I
think it's a condition we have. I think I told you guys we have that condition. But yeah,
I hope you guys don't catch it.
Our heart is in it.
It really is. Our heart is in it. So, and we know that's probably like 3 years behind, but that's where we're at.
Our kids won't see this video.
Oh my gosh, they would be so embarrassed.
So embarrassed.
So, but the all day, every day thing, I'm sure you guys in farms heard that a million times.
I didn't teach farm.
Gosh darn it, I want you to teach farm. I need all the help I can get here. All right, let's just move on. So,
because I said that all day, every day.
Yes, she did say
in
all day
farm, which is also patho.
They're again, well, we already
because they are so close, like us.
They are exactly.
And I would tell you guys that all the time. Actually, in pathophysiology, I would mention a drug and say, "I know this isn't a farm course, but we can't talk about this disease process without talking about this medicine. But you're here to get in farm," and that's why we kind of go back and forth with farm and patho, because they really would marry well as big course.
They would be. Mm-hmm. They would be.
And we could teach it.
That's right.
How fun would that
imagine
be?
That. I mean, it's crazy enough that you guys get us at senior years right before you graduate together, but man, another course? Oh my gosh, that would be so much fun.
Be like, bam, sophomore year.
Bam, that's right. Year. That's right. Okay, so Garth Brooks, the medication begins with GA. So you can think, if you see a question on the test, maybe that is involving that medication, and maybe it's looking for a verse, you know what I mean? What we now call, gosh darn it, we used to call side effects. Now adverse reactions.
Side effects was so much easier though for our brains. Why can't we just say side effects?
Oh my gosh. You'll know that medication has friends in low platelets because Garth Brooks sang the original version. GA, remember that. That's basically the point. Long story short, remember that medication, low platelets. So that was, like kind of a give me one, but we thought we would prepare you with some other important test taking strategies. So, Di, what are some of the test taking strategies you'd like to give?
Well, I'm going to repeat some of the ones that I told you in patho, and hopefully you guys remembered them, is to not wait to the last minute to study. I mean, that's just a gimme. Farm, just like patho, has a ton of information for every exam because we have to get it all in. And so if you can study a little chunk of it as you go along, you'll be much better in the end. Farm is probably even a step more challenging than patho because a lot of it's memorization. In patho, we would say, hopefully you can figure it out and it can make sense in your brain. Well, farm just is farm.
Oh my God.
You have to memorize it.
I thought of something.
Unless you have cute little things like she has to help you remember it.
You created a pathway to the farm.
Oh my God.
Oh my, see how they go together?
A path to the farm.
A pathway to the farm. Since you guys know I go on the farm.
That's brand new. Hot off the press. Just came up with
here
that.
in the ear first here.
It's coming all the time.
That's right. So that's a very good strategy. Mm-hmm. So another strategy, I mentioned it yesterday, but just to drive the point home, is in the Kahoot game yesterday, I mentioned about additional information being in the stem of the question. So it might say blah, blah, blah about this medication. What else are we concerned about? And there's, answers and whatnot. But that blah, blah, blah might be important. That might be the part that is being asked about on the actual test, because we're not going to ask the exact same questions. We don't want you just to memorize questions and answers. You're going to be taking care of people's lives. We don't want to be like, uh-oh, I didn't memorize that question when I'm trying to like save your life and stuff. So we got to get the critical thinking going. So that's why we kind of baby step and set it up this way so that you guys get used to it and whatnot.
Right.
So pay attention when you're doing the reviews, looking at the Kahoot questions, to all of the information, not just the correct answer.
Right, because if you memorize those Kahoots, and just like our Patho course, if you memorize the Kahoots, it's not going to be the same exact question in that same exact order, but the information is there. So again, Carrie says critical thinking started, clinical judgment. This is all building, at your sophomore level, what you're coming with, but this is building skills that you're going to take with you your junior level and your senior level, and as a practicing nurse to make those good clinical decisions, which keeps your patient safe and gives high quality care.
Absolutely, and that's what we're aiming for here. Another tip that I want to say before I forget, because that will happen, it just did.
Select all?
No.
Oh.
No. Okay, that I told you guys yesterday that the order of the test. I told you that I'll chunk it. I can do that at least for you guys. So the question, you won't know when one, chapter will end and another will begin, but at least maybe that could be a reference point to let you know if you're, selecting answers and whatnot, that, I think I'm kind of around, chapter 20-ish. So I said I would also do that for you. The questions will be randomized. The answers will be randomized as well, but the questions will be chunked together. Can I tell you what I taught them about helminths? Because you know that helminths are worms.
Yes.
I don't have to tell you that. That's just well known in the nursing world.
Yeah.
That sticks with you forever. I told them about, the mayonnaise or the mayonnaise adjacent product, helminths.
Helminths, yeah.
Bring out the helminths and bring out the best. Get it? Because you want those worms to come on out.
That's good.
See?
I like it's things like that will help you remember farms. Seriously,
that will make
those
up for
are
the nonsense.
kind of little things and watching videos, like our Z-Dog MD, that he has funny parodies on different medications. He also does disease processes, and I didn't show him any in Patho.
Shame on you.
Shame
I'm
on me, is
disappointed
right.
in
We
you.
had so much going on.
Yeah, because we got nothing going on in farm.
Oh,
We're just
we had so much.
kicking back.
You're so much better than me.
No, I'm not. I told them to watch it on their own, so I didn't show it in class. So we're equal in that regard. So what's another testing strategy you'd like to give?
There are no rhyme or reason when we write tests, like, oh, you got a bunch of C's in a row. That can't be right. One of these has to be a different answer. We don't look at that, by the way, guys. So don't think if you're picking a bunch of C's on multiple choice questions that you're screwing up because you got 4 C's in a row or something. That's not something we look at. In addition to that, when you get a multiple, do you do multiple select questions?
I do multiple select questions. And just like you, I believe I give partial credit. Do you give partial credit?
I don't think I did multiple select in Patho. I do it for critical care, but in Patho, I think we stuck to multiple choice for that cohort.
You're raising it. We're raising it up in our course here in farm.
There you go. And your CC, because now they're ready for those multiple selects. So read a multiple select like a true or a false. So read all of those and don't think, oh, we had 4 multiple select questions, but there were 3 choices for each one, so I must have screwed up. Same theory. We don't look at that. I will tell you that there are some rules that Carrie and I both follow when we write multiple select questions, and that's the NCLEX rules, that at least more than one answer has to be right to call it a multiple select question, and never is all of the answers going to be correct, because that's not a rule of NCLEX either. Yes.
Okay, I have a question here, teacher person. So is that like going to be consistent throughout my educational journey here at the University of Akron?
We would hope it would be, because hopefully we strive for consistency through all your courses. But if you're ever wondering what the test is going to be like, because that's part of the anxiety when you're in a new course, ask your professor for that test. If you do have alternate format questions like multiple select, what are your rules for it? Will I only have to choose one sometimes, or there will be some times where all of them will be a choice? So always have that conversation about your exam with your professor before you take that first exam in any course.
And I think a good way to maybe phrase it to come off very well and maybe give the response you want is, oh, we had Carrie and Diane for Pharm and Patho, and they taught us how things are going to be on the NCLEX. And we were wondering if that applied in this course as well, where the multiple select will have at least one, but not all of the selections checked.
And that's a great point, because that's what we're trying to build you to, is that ultimate exam, which is the NCLEX that you'll take to get licensed. And also the NCLEX gives partial credit for the multiple selects. And so you probably do follow that rule, don't you, Ms. Wismar?
I do, and I believe that's how the conversation started.
That's right.
So circling it back around, see how we always do that, tying it in with a crisp bow there. Okay. One other thing real quick to tell you guys, sometimes students get caught up in the distractors. If you see a response that you can select from that's kind of wackadoodle or is a term you've never heard before or something crazy like that, a lot of students are like doubting themselves, like, oh, maybe I was supposed to know that. That sounds fancy. I should select it. Is that a good strategy?
Not a good strategy. If you haven't heard of it, just because it's a fancy term, it's probably not the right answer. That's why it's called a distractor, because it's trying to suck you into, do you really know your stuff, or are you just picking something because it sounds fancy? So you might get to the right answer, and it might not be the coolest answer or the fanciest answer that you want, but it's the right answer. So just trust your studying, have confidence in your preparation, and don't get sucked into fancy words.
Exactly. So hopefully you guys enjoyed these few tips that we've shared with you, and now we're inspired to go out there and study hard and get ready and you know, be very successful on that upcoming Pharm test. So any last words?
No, good luck, guys.
All right. We'll see you
guys
later. I'll see you Wednesday. Bye. Good luck, guys. Bye.
Bye-bye.
All right. You end it because you don't know how. I know how. I don't know. Whatever if the words are.
I just am better at some things and she's not. So
that is true. Very true.